Welcome, everyone, and thank you for joining us again today. So we're excited to have you with us for our 7th webinar in the Small Flock Poultry Fundamentals for Veterinary and Extension Professionals series. So again, this series was developed to provide practical research-based information to professionals who work with small flock poultry owners but don't necessarily specialize in poultry. And over the first 6 webinars, we've really built a foundation for understanding poultry, managing the flock, reducing risks, and thinking about how they connect to food safety and public health. So today we're shifting focus a little bit, and we're going to focus on recognizing common poultry health problems, and more importantly, what to do when somebody brings you a poultry health concern, especially if you don't immediately know the answer, and I don't expect you to. So before we do get started, again, a quick housekeeping note. In the interest of time, we will hold questions and discussion until the end of the presentation, but feel free to enter any questions you have come up in the chat so you don't forget them. And there will be a couple of times where I will invite participation, and at those times, feel free to chime in the chat. Yeah. So you guys are obviously watching this live currently, but if somebody is watching this as a recording later, thank you for being here as well. We're hoping that the series is providing tools and resources that you can apply in your own work and help build your capacity to support small flock poultry owners in your communities. I always do have to start off with a couple of housekeeping stuff, acknowledgements. This series is developed with support from the USDA NIFA through the North Central Region's SARE program. The full funding acknowledgement is here for your reference. We're always grateful for their support, especially when it allows us to help our small flock poultry owners. And then a couple of disclaimers. The full statements are here for reference, but the important one for today's topic is that this presentation is for educational purposes and is not a substitute for veterinary medical advice. So let me briefly introduce myself. I am Tatiana Fisher, an assistant professor and the state poultry extension specialist at Lincoln University in Jefferson City, Missouri. My extension and research work focuses on small flock poultry production, including flock health and management, biosecurity, and dealing with practical questions that come up when we're working with poultry owners. A big part of my work recently has been helping professionals who support these producers feel more confident in recognizing issues, communicating risk, and knowing where to turn when something goes beyond their expertise. So that's particularly relevant to today's topic. As I said in the introduction, today we're going to shift from talking about how we support healthy flocks to what happens when something isn't quite right. And we're going to approach that differently from what you might expect from a presentation on poultry health. So this series was designed for both veterinary and extension professionals, and so far most of our content has applied similarly for both audiences. Today's topic is a little different because our roles in supporting poultry owners can be different. So an extension educator may be the first person who gets a phone call, and perhaps the veterinarian is actually the person that the producer needs to see. The reverse might also happen. I regularly get calls saying, such and such vet gave me your number. And I have to start those off with, I'm a PhD doctor, not a DVM doctor, but I will try to help you. And usually I have to let them know what the limitations of my role are, both legally and logistically. Ultimately, we have a shared goal to recognize what's abnormal and determine what to do next. So this entire presentation will focus on that shared role, although there might be times where I'm talking a little bit more to one side than the other. Because what happens after we decide what to do next really depends on your role, your expertise, and the situation. So I said we're going to do it a little differently from what you might expect. What does that mean? So there are tons and tons of poultry diseases and health problems to cover, and there's no way we could cover all of them in an hour. And memorizing a long list doesn't actually help us anyway. Instead, what we're going to focus on is the process. Recognize what we're seeing, ask useful questions, connect the information, decide what matters most, and then determine what needs to happen next. So this is not about becoming a poultry specialist in an hour. It's really about having a process that you can use when you don't immediately know the answer. And honestly, I'm hoping that you can use this same process really for any species that you're working with. So again, we do have to consider our professional boundaries. There are some questions that will naturally fall within extension professionals' role, things like management, nutrition, housing, the housing environment, production factors, even helping determine whether something is or isn't normal for a species. There are other situations that are going to require veterinary involvement, particularly if examination, diagnosis, treatment, or veterinary oversight for another reason is needed. And those, again, those boundaries are important, but the work isn't one directional. We're not always having extension educators sending people to veterinarians. Sometimes we are receiving from veterinarians as well. So the goal, again, is not to have the answer ourselves. It's to recognize what we can address, what requires additional expertise, and where to find that expertise. So with those boundaries in mind, the objectives of today's webinar are to help you learn how to recognize common signs of abnormal health in poultry, gather relevant information about a poultry health concern, connect observed signs with potential contributing factors, prioritize health concerns based on severity and risk, and determine the appropriate next steps, including when to refer. So what do we actually do when somebody calls and says, something is wrong with my chicken? Maybe the producer says, my chicken isn't eating. Maybe they send you a video of a bird that can't stand. Or maybe all they tell you is something is wrong. Sometimes they give you a lot of information. Sometimes they give you almost none. Maybe they're describing what the bird's doing, or they're going to give you a photograph. The question becomes, what do you do next? Most of us are going to jump to trying to figure out what's wrong. What are we seeing? But I want you to take a step back, and instead of immediately trying to figure out what is or isn't wrong, I want you to work through a framework that we've actually seen earlier in this series. So in our biosecurity webinar, we used this framework with 5 steps: observe, ask, connect, prioritize, act. We're going to use that same process throughout today's webinar. When we're looking at observe, we want to know what is actually happening. When we're looking at ask, we want to know what else do we need to know. Connect, we look at what those observations and those answers are telling us. Prioritize, we look at how much this matters. How severe is it? Does it need to be addressed now? Can it wait? And then act. We decide what should happen next, or at least what we should recommend to the producer. Many times we're not actually the decision maker in this particular instance. So act can mean addressing something yourself. It might also mean going back and gathering more information, monitoring the situation, recommending veterinary evaluation, consulting another professional, or referring somewhere else. The important thing here is we're not using these steps to force every problem into a diagnosis. We're using them to move from something is wrong to I understand the situation better and I know what needs to happen next. So we'll start with the first step, observe. Before we try to explain what's happening, we need to be clear about what we're actually seeing or hearing. That sounds simple, but producers often come to us with an interpretation rather than an observation. They might say, I think my chicken has worms. That's different from my chicken has diarrhea. The first is a conclusion. The second is something we can investigate. So always start with what you can actually observe. Now, caveat to that, I have had a producer send me pictures of tapeworms in feces of a chicken, and you can see those. So once we're actually looking at what we're observing, we then start to ask questions. What else do we need to know? There's a lot of different questions that we might ask. And we're not always going to want to ask every single question, but here is a list to consider. Who? How many birds are affected? What age are they? What species are they? If you've got multiple species on a farm, that can help differentiate what might be going on. What signs are they seeing? What behavior changes are they seeing? What's the onset? How long has this been going on? Is it getting worse? Is it staying the same? How many? Is it one bird, many birds in the flock, the whole flock? And has anything changed? So again, we're looking for things where we might be able to get more information that we can connect to what we already know. So when we're actually making connections, we'll take what we're observing and what we're hearing from our questions that are getting answers to, and what we already know about poultry biology, management, nutrition, disease, environment, and we start putting those pieces together. Once we put these pieces together, we get some potential explanations. So we're not necessarily trying to name a disease, we're asking what could explain what I'm seeing. And that's a really important distinction because a sign is information. It is not a diagnosis. And many of us are not in a position to make a diagnosis anyway. The same observation may have very different explanations depending on the context. So once we have some idea of what might be going on, we still have another question to consider. How much does it matter? So our fourth step is prioritize. Not every abnormal finding requires the same level of urgency or significance. We have to consider several different things, like how severe the problem is, how many birds are affected, how quickly is it developing, especially if it's getting worse. Are birds dying? Usually that's a pretty good sign that it's a severe concern. And then context. Does the situation suggest greater concern, potentially beyond that flock? And then finally, we look at how we can act. So once we've gathered enough information and we've decided what matters most, we have to determine what happens next. Sometimes we can address that concern right away with a specific recommendation. Sometimes that appropriate response is to educate or make a management change or to monitor the situation. We may also need to gather more information or monitor for changes. And then sometimes we need to involve another professional or resource. So ACT doesn't necessarily mean that we're diagnosing and treating. It means that we're determining the next step. So again, our process is observe, ask, connect, prioritize, act. And we're going to keep coming back to those 5 steps throughout the rest of the webinar. But before we put them into practice, we need to start with the basic question. What actually counts as abnormal? So we've talked about the process that we can use when somebody brings us a concern, but that process starts with recognizing that something has changed or that something isn't right. And that sounds really obvious, but abnormal isn't always as straightforward as it sounds. We may notice a change in how a bird looks or behaves. We may notice a change in production, or sometimes the owner is simply telling us, this isn't what my chickens normally do. Our job isn't necessarily to explain the change, it's to recognize it and help to describe it accurately so that we can pinpoint what's going on. And that brings us back to something that we talked about earlier. Start with the observation before you start with the explanation. The challenge, again, is that we can't always recognize abnormal if we're not familiar with these species already. So we also have to have some idea of what normal looks like. So I think of normal as baseline behavior and appearance. So a normal, healthy bird should be alert and active. breathing normally, moving normally. We can expect an appropriate body condition, and we expect the bird to be eating and drinking. For production birds, we might also want to consider whether production is appropriate for that particular bird. And these are fairly basic things that we can look at when we're trying to decide whether something has changed. Many times we're going to rely on the owner or producer for their evaluation of how different this is from their normal, or what is normal for their flock and how different the abnormal is. But the more time that you spend around poultry, the more comfortable that you'll get recognizing what normal looks like for different birds and different situations. And it's really important to think about the fact that normal does vary a lot. And the baseline is not going to be the same for every bird. A young chick is not going to behave like a mature laying hen. A broiler isn't going to have the same body type or growth as a heritage breed. And a hen with chicks may behave very differently from hens in a breeding flock with a rooster. Even within the same type of bird environment and production stage, we may see differences between flocks. And so that means that we don't necessarily want to define abnormal based on a single picture of what we think it should look like. We always need to think about it in context. So when we're assessing a poultry health concern, what should we start looking for? We can think of a few different areas. Behavior, is the bird alert, active, responsive? Are they eating and drinking? Appearance, what do their feathers look like? Eyes, comb, body condition. Breathing, is their breathing quiet, normal? Is it taking extra effort? Are they making more sounds? Are they coughing when they breathe? Droppings, people will frequently contact me about poultry droppings, and you do have to have an idea of what normal looks like there. But looking at appearance, frequency, has it changed? Here's an area where it does help to know how experienced the producer is. Newer owners are more likely to think normal chicken feces is diarrhea than more experienced producers. Big red flag in droppings tends to be is blood. If anybody tells you that they've actually seen blood in their chickens or other poultry species droppings, that's a big thing to put in your mind. Movement, is the bird walking, standing? I've had at least one person tell me that their chicken was unable to walk, and it turned out she was just a broody hen who refused to walk. Again, experience of the producer does matter a little bit here, but we really don't need specialized equipment to see most of this. Also, production, that can be information in and of itself. Is the bird producing the amount of eggs that they're expecting? Is it growing on its normal growth curve? Again, we don't have to go through this entire list every single time for every bird or every flock, but the point here is to develop the habit of looking at the whole bird and the whole situation rather than focusing on one single sign. So here's a bird who is clearly looking poorly. What's wrong with her? Unknown. It doesn't really matter, but she is clearly a bird who is not feeling well, and you can just, even with fairly little experience, I think that you can see that in this bird. Now, there is an important complication. We are not always standing next to these birds ourselves. A lot of the health concerns we encounter come to us by phone, email, text, or other messaging forms. So how do we make these observations when we're working remotely? This is where those specific questions become really important. Instead of asking, how does a chicken look, which might give us a really general answer, we might ask, is it standing or laying down? Is it alert when you approach it? Is it eating? Is it breathing with its mouth open? Do you see any discharge around the eyes or nostrils? I'll give you one example with the broody hen. This was a phone call, and I asked the producer, who had a handful of chickens. I asked them what made them think the chicken couldn't walk, and they said she hasn't left the nest box in like 2 days. And they'll poke at her and she won't get up. And I told them, like, it's possible that this chicken is broody and just wants to sit on eggs. Here's how I would test this. And I asked them to basically take the chicken out of the nest box and put her down somewhere else in the coop and see if she gets up and runs back to the nest box. And you might be able to guess what she did. She absolutely got up and ran back to the nest box because that chicken's mind was telling her she needed to sit on eggs right now. That's all she was doing. So there was nothing wrong with the bird except that she was broody. So we're essentially helping the producer turn a general concern into specific observations. And when appropriate, pictures and videos can be very helpful. They are not a substitute for examining the bird, especially for a veterinarian. There are requirements for that veterinary client-patient relationship that have to be met that probably can't be met remotely most of the time. But we can get a lot of information that we wouldn't otherwise have just with what the producer or owner is telling us. So again, though, we need to be careful to distinguish what we know from what we're inferring. So once we've looked at the individual bird, we also want to step back and look at the flock. How many birds are affected? Is it one bird, a few birds, or are we seeing the same problem across much of the flock? The number of birds affected can change how we think about the situation. One bird with a problem is very different from several birds developing similar signs. So the distribution is information in and of itself, particularly in terms of how widespread is the problem. But again, that's only part of the picture. We also want to think about how quickly this is developing. So did something change very suddenly? Did several birds become sick over a few days or weeks? Or is it something that seems to be a recurrent problem that comes and goes? This timeline can really help us distinguish between a few different possibilities, particularly if you're dealing with respiratory illnesses in birds. And it can help us also decide how urgently we need to respond. So we're, again, not asking just what is happening. We're also asking about how many birds are involved and how quickly it might be changing. So all of those together help us to create a better picture. But even when we do recognize something is abnormal, we still shouldn't assume that we've identified a disease. So a health problem is broader than disease. A change in appearance or behavior could be related to nutrition, management, the environment, parasites, trauma, or a combination of factors. Here's a chick who has a tendon issue with a leg. It's not a disease, it's a developmental issue. A hen who has been pecked on by other birds. Again, not a disease issue. This is it's an injury. The last picture is actually, I'm going to tell you about it and then I'll show it to you. So I had a Jersey Giant rooster who was limping. He was having trouble walking, and I couldn't figure out what was going on. So I finally picked up the bird and I examined his whole leg, starting at the bottom and just going up. Everything felt mostly correct until I reached the top of his leg, at which point I found a leg band had worked its way up over his hock and wrapped around his thigh. And it was actually restricting his ability to move. And that was very easy to fix. I just took the leg band off. He was fine. Usually when I see leg band issues, there's zip ties. This was actually an open spiral leg band. And it had just happened to move in the wrong spot. So again, our goal here isn't to jump to a diagnosis from a clinical sign. We have to take all of these factors into consideration as potential causes, and we might be dealing with multiple factors that are working together. So our ultimate goal is to recognize the abnormality and then understand the context and start asking what could explain what we're seeing and what additional information would help us sort through those possibilities. And that's what we're going to work through next. So I'll put this into practice with some kinds of questions and observations that producers have actually brought to me. And I will move through these fairly quickly, but there is a mystery case that I'm going to want you all to really think about. So start putting your thinking cap on now. So as we go through these, keep thinking about the same questions we've been using. What are we observing? What would we want to know? And what might change the way that we approach it? So here's a question I get relatively frequently. What antibiotic should I use? And there's usually a little bit more information behind it because I hesitate before I start to answer. And the producer might say, well, my chickens are sneezing. What should I give them? And as an extension professional, I'm not actually in a position to prescribe an antibiotic. In general, that's going to require a veterinarian to be involved. And a veterinarian will need to evaluate the bird and determine whether treatment is appropriate. There also, unfortunately, are very few antibiotics approved for use in poultry, so it may, even for a veterinarian, not simply be a matter of picking an antibiotic off of a list. But beyond those considerations, antibiotics are often not the correct solution for the situation anyway. So before we start thinking about a treatment, we have to back up. I want antibiotics for my sneezing chickens. Is the producer inferring what's going on as opposed to you being able to actually see what's going on? So what are we actually seeing? We might ask this producer, how many birds are affected? How long has this been happening? Is there nasal or ocular discharge, facial swelling, increased respiratory effort, changes in feed or water intake, reduced egg production, mortality? There's a lot of additional things that might help us understand what might happen, what might be happening with those birds. And we might ask some other questions like, have new birds been introduced recently? Has something changed about the environment? Have birds been to a show and come home? These are all potential ways for a bird to get a respiratory disease. One that we might think about and be particularly concerned about would be something like Mycoplasma gallisepticum. But sneezing by itself and even nasal or ocular discharge with sneezing isn't enough to tell us for sure what we're dealing with or that an antibiotic will help. So the producer's request here is telling us what they're concerned about and what they want to do, but it doesn't replace the assessment of the problem. So depending on the situation and your role, the next step might be education and management recommendations. It could be gathering additional information, or we might refer these birds for further evaluation and possibly diagnostic testing. And again, antibiotics aren't the only treatment request that we'll hear. Another common question is, should I deworm my chickens? Or it'll be expressed as, how often or when should I deworm my chickens? And the first thing that I usually ask is, why? Why do you think that they need to be dewormed? What are you seeing? Which birds are affected and how are they being raised? Are they indoors, outdoors? Have they recently been moved outdoors? Outdoor and pasture access can definitely increase opportunities for exposure to internal parasites, including roundworms and tapeworms. We also might want to know what else they're seeing. Are they seeing changes in the droppings, weight loss, reduced production, or mortality? Deworming is definitely a different situation from antibiotics because depending on the specific product and situation, poultry owners are frequently able to get medication to deworm their birds without veterinary involvement because they can get them from like a farm supply store. But just because they can get that treatment easily doesn't mean that that's what the birds need, and it doesn't mean that we should jump to it because that's what the producer suggested. So we still want to understand what they're seeing and what is actually going on with the birds and whether the treatment is going to fit the situation. So again, we're starting with an observation, using questions to determine what might be going on before deciding what to do next. And then sometimes our producer isn't asking us about treatment. They're trying to understand something they're seeing. So this is a call I get particularly in the middle of the summer. I've lost a couple of my young chickens and I'm worried something is going through my flock. So before we start thinking about what could cause this problem, we'll think a little bit more about what they're actually seeing. First, we might ask how old they are. That matters because their young chicken can mean many different things. A very young chick, an adolescent bird, and a young adult can have very different problems. Um, so we'd want to know how many have died over what period of time. And are they showing signs before they die? Are other birds affected? Let's say we learn that these are adolescent birds and the producer has lost one or two every few days. And it's been going on for a couple of weeks. It's been definitely a period of time. It wasn't all just overnight or anything. And they were recently moved outdoors into a larger group of older birds. And that's when this started. So that actually gives us a pattern. And that pattern can change how we're thinking about the problem. In this particular case, I might be thinking this is a red flag for coccidiosis because that fits with the age and the timing and the environmental exposure. Now, the producer is often worried about something much more serious, like highly pathogenic avian influenza, which we will talk about more next week. And we shouldn't dismiss that concern, but we can usually ask whether those signs and patterns we're seeing are actually fitting that. And most of the time, I can reassure the producer that a situation like this, one or two birds dying every day for several weeks, is probably not avian influenza. And again, it's an important distinction that we're looking at. Recognizing a possibility is not the same as making a diagnosis. So I can never say it's definitely not this and it definitely is that. But we can use age, timing, the number of birds affected, and our other information to get an answer that makes sense. Now, sometimes we're not dealing with mortality. We're dealing with a different problem. So this time of year, we start seeing this quite frequently. My chickens are losing feathers. So this is a good example of a finding that's real, but not very specific. There are a lot of possibilities. Could be normal molting, feather pecking by other birds, over mating by a rooster, could be parasites or something else entirely. The observation here is useful, but it doesn't help us figure out the cause. We usually are going to definitely need more information. So think about what you'd want to know. I would start by asking, where are the feathers missing from? What parts of the body are they missing from? How extensive is that feather loss? Is it one bird or many? And when did it start? We also might want to know the age and type of bird that we're dealing with. I'm going to suspect molt if we're dealing with, 1-year-old birds in the fall is going to be high on my list of things to consider would be molt. But feather loss is also not the only change we might be seeing either, this time of year or in a situation like this. So we might get somebody who's saying, hey, my birds have been laying really well, and now they're not laying like they used to. Again, a useful observation that doesn't tell us a whole lot. So reduced egg production could be part of normal seasonal related or age related decline. It could be related to extreme heat, or nutrition and management can play a role. So it's important to understand what not like they used to means, but also how old the birds are, what changed, how much it changed, how quickly, and what else is happening. And again, one thing to be kind of cautious about is that there can be health problems behind production changes, things like reproductive diseases, tumors. There are issues that there are some infectious diseases that can cause reproductive problems. But we don't always want to assume that reduced egg production means the birds are sick. And we also don't want to assume that they're normal and it's just declining because it fits with the season. We're going to ask additional questions to try to figure out if this is something to be concerned about or not. And one thing to keep in mind is that sometimes reduced production isn't actually reduced production. I've had personal situations on our farm where we lost egg. We were not collecting as many eggs, but the birds were producing them. The problem was that we had hens eating eggs, or one summer we had skunks getting into our pens and eating eggs. And in both of those cases, there weren't a lot of outward signs except that the egg production decreased for a while. Now, sometimes we get even less information, and a little bit of maybe an emotional aspect. I found my favorite rooster dead. As we start asking questions, the owner might tell us more. He'd been a little quieter than usual. We didn't think he was sick, but he does seem thinner than he should have been. So, what might you want to know? But their questions and the way that this producer talked to me made it clear that they cared about this bird. He was a favorite, and they were surprised and upset that they hadn't realized something was wrong sooner. So this gives us a couple of concerns. One, we have a bird that has potentially an issue. Well, I mean, it's dead, so it obviously has an issue. But if we're worried about the rest of the flock and not just the emotional aspect of the producer losing a chicken that they cared about, um, we we have to be a little more cautious with a bird like this where there's not a whole lot of outward signs to help us with the underlying problem. So what would we want to know? I might ask how long that he's been acting differently, if they noticed if he'd been eating and drinking, had he been losing weight, were there any changes in droppings or behavior? And really importantly, are they noticing any of this in other birds? So if you're seeing repeated deaths, we definitely have to step back and take a look at the flock level pattern. But even if it was one single bird, the lack of obvious signs doesn't necessarily mean the problem wasn't serious. In my flock, it's been several years, but we've lost a few birds when we had birds on pasture because they would actually end up with impactions. And what was interesting about it is that they would die, they would essentially lose weight and die with no real outward sign that anything was wrong. But necropsy would then reveal an impaction. And I've seen a grass impaction in the crop gizzard. I've even seen one in the large intestine. So now the point here is not to say that a quiet bird is a bird that has an impaction. The point is that some significant problems can have very subtle outward signs. So we might not get a dramatic clinical picture that'll tell us what's happening. Sometimes our job is just to recognize that there is something not right and determine kind of how concerning it is. And in the case of a dead bird, I may recommend necropsy for further information. Some of that's going to depend on resources available and cost for the owner. But again, we're looking back at the pattern. So we're listening to the answers to our questions. And one of the things that I want you to notice is that my questions are actually pretty consistent regardless of what the producer is asking or sharing. We're frequently coming back to the same kinds of questions. Who is affected? What are we seeing? When did it start? How many birds are involved? And what has changed? So those questions are helping us turn an isolated observation into a pattern. And again, that pattern doesn't necessarily give us a diagnosis, but it helps decide what possibilities make sense. And that's that skill that we're trying to develop. I don't want you to memorize a list of diseases. I want you to become better at recognizing what we're seeing and then asking good questions and deciding what to do with that information. So now we're going to get into this mystery case. And instead of me doing all of the questioning, I am going to look to you guys for some potential questions. So this is going to be based on a real call that I received from an I will tell you an inexperienced poultry owner, and I will give you essentially the information in the order that I received it. And this time I want you to decide what you want to know next. I'll give you a little information, I'll pause and ask what you would want to know, and then hopefully you guys will have a few good questions, and if you don't, that's okay, because I'll tell you what I asked next. So again, if you're live here, feel free to share your thoughts in the comments, and if you're watching the recording, maybe pause and think about what your next question would be before I reveal the next piece of information. And again, our goal here is not to diagnose the bird from a few clues. The goal is to practice using our information and deciding what we need to know next. So we'll start with what the owner told me. I think my chicken broke its neck. It can't stand. If you were receiving that call, what would you want to know? Comment in the chat how many birds are affected. What are you feeding birds? That's a good question. Yeah, can its legs move? How old is the chicken? That's a good question. Yeah, also, going back to that observation, what makes you think the neck is broken? Yeah, so things like age, did something happen? What does the bird look like? Whether it can move its legs, all good questions. How many in the pen? Yeah, fun fact, this was an only chicken. So one of you caught this. Think about what we actually know about this chicken. They've told us that it can't stand. They also told us they thought it broke its neck, but that really is an interpretation on the owner's part, not an actual observation. So if we think about what we actually know, the chicken can't stand. Now, history, I asked how old it was. It was about 2 months old. I asked how many they had. One chicken. They had one single chicken. And then I asked how long it had been going on. Recently, it was obviously a 2-month-old chicken. Now, some of you who know a little bit more about birds and poultry in particular are going to ask the next question in my head. 2 months old, can't stand. Are we talking about a broiler who is at the end of its production cycle? And yeah, Penny, you got that. So my next question is what kind of a chicken it was. And the owner says, I don't know. It's white with yellow legs. Now, does that information change what we're thinking? Maybe. It makes that broiler a little more likely. So I asked for a picture. Ooh, I like that question. How much did you pay for it at the store? Yeah, so they told me how they got the chicken, and it was essentially they were involved in hatching eggs for like a classroom, and it was the only one that hatched. Um, so unfortunately, that wouldn't have gotten us an answer, although maybe knowing where they got the eggs from would. So this is where the limitations of remote conversations become really obvious. So when somebody tells you that they have a 2-month-old white chicken with yellow legs, that tells me a little bit, but it really opens up more questions. This is a white chicken with yellow legs, and it's 2 months old. This is also a 2-month-old chicken that's white with yellow legs. And in some ways, so is this. This is a Delaware cockerel. It's about 2 months old. So I asked for a picture. They sent me a video. So what does this add to our desire for information? What else would we maybe want to ask? What is the diet? Yes. What are you feeding it? And that was my next question. What are you feeding this chick? The answer was corn. And I'd never had the answer be just corn before, so I asked, is that all? What else are you feeding it? The answer was, that's all, just corn on the cob. So we're not even talking about cracked corn here. We're talking about literally corn on the cob. What does that tell us we are likely dealing with? Yeah, literally the only thing that this chicken had. Yes. So somebody's caught exactly what I caught. This poor chick has received essentially no protein and is almost certainly suffering from a nutritional deficiency. So, young bird, inability to stand, corn only diet. If we think back to our nutritional webinar, that's a big, big red flag for nutritional deficiency. Now, our understanding of this case has now dramatically changed, and we've gotten to a very different set of possibilities than where we started when the owner said they think the chick's neck is broken. So if we put these pieces together, we see a bird that can't stand. It's young. We're not sure what type it is, but we do know that it's a corn-only diet, and no type of chicken is going to grow on a corn-only diet. It can't stand. That inadequate diet likely means a nutritional problem. And at this point, we have a couple of concerns. There is obviously significant clinical concern for this particular chick. There's also a management concern for the owner, although, like I said, it was actually the only chicken that they had. And so we have a severely malnourished chick and an owner who clearly cares. So this chick had a name. The owner was clearly concerned. They just didn't know what an appropriate diet was for a growing chicken, and they thought that they were helping. So we can't just stop at, oh, you didn't feed your chicken right. That's the whole problem. Our response to them needs to be compassionate and practical and provide them with something that they can actually act on. So in this particular case, I recommended an appropriate chick feed and explained why it was important and provided them with direction on where they could buy appropriate feed. And then I was also honest with them that given the bird's condition, there wasn't a guarantee that it was going to recover. And depending on the severity of the situation in general and your professional role, we may have sent something like this to a veterinarian, although this case didn't need one. And that's really where we're looking at with ACT. So here in this framework, we're looking at supporting the owner by helping to correct the diet. But in other cases, we might need to do further evaluation or refer out. So for those of us in extension, that educational piece is really important. We're not just trying to identify what's wrong, but we're also needing to help the owner understand the problem well enough to make a better decision, either with that animal or with future animals. And again, that's really the skill that I want you all to take away from this. You don't necessarily have to know the answer when a phone rings, but you do need to know where to start figuring out what information you do need and how you can turn that into a meaningful step. And sometimes that meaningful step is knowing when to refer. So sometimes we have to involve somebody else, and we might know that right away. We might get there after asking a few questions, gathering information, and we might realize that the situation, requires something we don't have access to. Maybe we need a vet to examine the animal. We need diagnostic testing, necropsy, or treatment. And sometimes it might just be expertise that we don't have. That's not a failure. Knowing when you need help is part of doing this work well. And you don't necessarily have to go through the whole framework. Like, for example, if someone calls because multiple birds are suddenly dying after exposure to wild waterfowl, that's probably enough information to go ahead and give them the contact for the appropriate animal health authorities to check for bird flu. So we want to consider referral when problems are unclear or significant or they're worsening. If diagnosis or treatment is needed, the situation requires expertise authority. equipment or information you don't have. And, if it falls outside of your role or expertise, or sometimes you just need a different perspective. I've had a few things where I call and I'm like, hey, this is what I'm seeing. Does this make sense? How would you approach it? And when we talk about referral, that doesn't necessarily mean sending somebody to a veterinarian. An extension educator may refer to a producer to a veterinarian. A veterinarian may refer a producer to an extension educator or a poultry specialist. Either one of us might need to refer to a diagnostic laboratory. And then sometimes there's other resources that are more appropriate. So if we think back to our roles that we talked about at the beginning, remember that no one person has to be the expert in everything. And referral is also not just about handing the stakeholder off, giving them a phone number to call. The goal is to connect them with the person or resource that's best positioned to help them. And usually I try to stay connected to that stakeholder as well and make sure that they understand what they were told, they're asking the right questions to get the information they need. So ultimately, it's really working together more than it is handing somebody off. So if we step back from our individual examples, we started talking about poultry health concerns and how they rarely arrive as like a neat diagnosis. When somebody calls with a question or an observation or a concern, we have to help them figure out how to deal with that information. And we've worked through this process in several different ways, and you all did great with the mystery case. So again, this is that framework that I want you to take back. And we've used it now in a couple of webinars, and fun fact, we'll use it again in our final webinar. But always start with what you actually can observe. Know what looks normal and what you're seeing that's not. Ask questions and gather that history before you jump to any conclusions, and link that what you're seeing with what you know, and always kind of prioritize. Definitely think about the severity and the speed of which things are moving through a flock, and make appropriate recommendations or refer. Again, you don't have to always have the answer. Now, if you were hoping to have more resources for understanding specific health concerns, I have several resources here that I like to use. These are all resources I would encourage you to bookmark rather than go and explore right now. They each serve a slightly different purpose, and I will make sure that these links are available with the recording. But a lot of these are useful for both small flock owners and those of us that work with them. And then I want to highlight one resource specifically for any veterinary professionals in the group. So this webinar was intentionally broad and focused on professional reasoning rather than in-depth poultry medicine. But there is a poultry medicine course for veterinarians in private practice that was developed by university poultry researchers and veterinarians. And this is it's an online self-paced course that does qualify for continuing education credits. It's specifically designed for general practice veterinarians. I do believe it costs money. I don't know what it costs. So I'll include that link too if that's relevant to anybody. And again, we have our final webinar scheduled for next week, and we'll take this one step further by looking at highly pathogenic avian influenza and other reportable poultry diseases. So with that, I want to thank you all for joining me today. Thank you for all the work that you do to support small flock poultry owners. And I hope that this is going to give you some practical ways to think through poultry health questions, even when you don't necessarily have the answers yourself. So thank you for being here. Again, if you want to stay connected with our program, there are several ways to do that. You can follow us online, connect with me directly. That's all on the screen. And then if you're watching this recording and you'd like to join us for our final live session, we'd love to have you. Scan the QR code or go to this link. And then finally, I want to introduce one thing as another way to stay connected for anybody who uses Facebook. I recently started a Facebook group called Small Flock Community of Practice. And this is going to be intended to be a space for veterinary and extension professionals who work with small flock poultry owners to stay connected beyond this webinar series. So the idea here is to share questions, experiences, resources, and practical solutions, and to learn from people who are doing this work in different communities and settings. because small flock work can look very different, but we can also learn from each other. So if you'd like to continue these kind of conversations in a group like this, feel free to request to join. And then with that, I'll open up to any questions